Southern California is probably one of the most competitive parts of the country for Medicare Advantage plans. There are just so many options and so many different plans, even within the same carrier. It also means that there are dichotomies of Medicare Advantage plans that you see every day, like massive insurance providers like Anthem Blue Cross, and the more local, almost sort of boutique level insurance carriers like the Scan Health Plan that puts out plans that each have their strengths and weaknesses. So today we're going to look at 5 things on the Scan Alta plan as well as the Anthem Select Medicare Advantage plan available in San Diego County in 2025. Hi, Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is the best Medicare option for them this AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. Looking at the Anthem Select plan and the Scan Alta plan available in San Diego for 2025, I think there are a lot of similarities and a few important differences between them that could be very valuable to a Medicare beneficiary trying to decide which option fits their healthcare needs the most. They are both going to be HMO style plans, and they're both going to have some overlap between the doctors and hospital networks that they have under contract. I think both are going to be great plans on their own, but there is definitely a difference in the type of experience the client feels interacting with those carriers, which could be a deciding factor in a person's plan choice. But first things first, the first thing I always look at on really any Medicare Advantage plan is going to be the maximum out-of-pocket, which is called the MOOP. This is the most amount of money on the plan that a beneficiary will end up having to pay in the worst case scenario. These caps are one of the great benefits of having a Medicare Advantage plan in general, because there are caps on healthcare spending that don't really exist on original Medicare Part A or Part B or put together. That being said, when we look at the Scan Alta plan, I would say it has a maximum out-of-pocket. I have not seen anything lower than, at least in 2025, and that's because the MOOP on the Scan Alta plan is $500 for the year, which is a big drop even from 2024, where it was just $750. So I don't know how often you see that. When we look at the Anthem Select Advantage plan with its MOOP, it's going to be set at $2,500 for 2025, which really is, in the grand scheme of things, is pretty good. It is the medium rare of MOOPs that are out there. Also, I'd want to note that these MOOPs include just the cost for healthcare. So they don't count any costs that enrollees or Medicare beneficiaries could spend on their prescription medications, which for 2025 is going to be capped because of new regulations at $2,000, which I mean, that's a pretty good regulation, but that is not included in the maximum out-of-pocket or the MOOPs. So just to make that clear. Next up, let's look at something that is really very common on both of these plans, but in general is pretty much, I guess it's the established norm for Medicare Advantage plans, at least here in Southern California, which are the deductibles. A deductible is essentially an initial spend that a beneficiary must spend prior to the insurance benefit starting to assist with financial costs. And they are really common under 65-year-old plans, or maybe a plan through someone's work or a health exchange. Even your car insurance usually has some sort of deductible. But luckily on the Anthem Select plan, there's not a deductible, nor on the Scan Alta plan, there's also not a deductible either. So from the very first time that someone goes to see a doctor or the emergency room, there is just going to be the copays that go along with those visits, but no initial upfront spend to meet a deductible. Ultimately, that's pretty good for sure, even if it is, par for the course. Speaking of copays for utilizing services, let's take a look at what are the costs for visiting primary care doctors or specialist visits. Because these oftentimes are the biggest concerns of our client, even though they don't really represent potentially the biggest cost a Medicare beneficiary may have, they are the most visible, the most used benefit, as people will see a doctor at least a couple of times a year, but may never, knock on wood, ever meet that maximum out of pocket. When we look at the Anthem Select plan, we can see that the cost to see one's primary care provider is going to be set at a $0 copay, which who doesn't like a $0 copay? But if one was to get a referral to go see a specialist, then there would actually be a $10 copay to go see that specialist doctor for each visit. So sure, not a king's ransom, but it is definitely something. Now, switching over to the Scan Alta plan, they are going to have a $0 copay for both the PCP as well as the specialist doctor's visits. Again, since these plans are both going to be HMO plans, it does mean that in order to go see a specialist, somebody has to start with their primary care doctor, then get a referral, possibly go through a prior approval process, and may have limits on those specialty visits or specialty care. But that is sort of the reason why HMO plans can have no or very low costs for the healthcare services. One interesting aspect for the Anthem Select plan, and the Scan Alta plan for that matter, is how they deal with dental coverage. This is because dental coverage is not actually covered under Medicare. Medicare Advantage plans do not have to offer them, but they typically do as extra benefits. Usually it's just kind of basic dental, which covers things like normal cleanings, x-rays, fluoride, and the more run-of-the-mill types of procedures. But the Anthem Select actually does include both preventative as well as comprehensive dental benefits that will include more expensive dental services that are not typically covered. So things like endodontics, bridge work, implants, and dentures, but it's not unlimited. And by this I mean they put a yearly cap on how much dental spending can be done at $1,500 for the year, which does mean that maybe it's best that you get your denture started in December and then finish them in January. Just saying, 2 separate years. For the Scan Alta plan, there is going to be more of a traditional standard dental coverage that will come automatically with the plan. And I would say it's probably more of like a standard plus because it does cover more than just cleanings and x-rays, but it's not what I would say is comprehensive. That being said, there is also an option to upgrade to comprehensive PPO style dentals with the Scan Alta, but that's going to have a $55 premium monthly that goes along with it. So it is a nice option, but if dental was the one thing you're concerned about, both would be things you would have to kind of weigh out. A more unlimited selection, but with a limit to how much you can spend, or no limit to how much you can spend, but a more limited selection. Yeah. I guess last up today, let's talk about a benefit that is super important and often is taken for granted, at least until one needs it, which is ambulance coverage. Because ambulances are not cheap, and just a pro tip, if the ambulance comes to pick you up, it is better to go in the ambulance, go to the hospital, pay the copay, because if they come and you turn them away, you could potentially get billed for the full amount, not just the copay. So for the copay and an Uber ride back, it's probably still way less expensive than the raw ambulance costs. Just saying. Anyways, when we look at the copay for the ambulance under the Anthem Select plan, it's going to be set at a copay of $250. That is for ground and water ambulances. But ambulances, on the air, it's going to be spicy. That is a 20% co-insurance. And 20% isn't that big of a percentage, but air ambulance bills can get pretty big, and 20% of a lot is still a lot. It's still a lot. Looking at the Scan Alta plan, they have their ambulance cost set at $75 copay for a one-way trip. So at least for ground and water ambulances, it's going to be on the more medium rare side of costs on the Scan Alta plan. So overall, looking at the Anthem Select plan and the Scan Alta plan available in San Diego in 2025, I think it's important to realize that everyone's situation are going to be different, which means which plan fits their needs is going to be different. I mean, take the dental benefits, for example. If you really need dental services, having a limit of $1,500, but wider options for services and no cap, that's one thing that could be a deal breaker in comparison to the Scan Alta. Also, these plans are way more complex than just the 5 things that we just talked about. There are doctors' networks, there are medication formularies, there's a whole plethora of other things to take into account when looking at these plans. So that is basically the longest possible way of saying if you or somebody you know is trying to make some of these tough Medicare decisions this AEP or really all year round, please feel free to reach out to us at the information down below, and we can help them to make those tough Medicare choices over the phone or in our offices across Southern California in English or Espanol. Also, don't forget to like and subscribe so you can get updates when our newest videos come out, because we have new great Medicare content coming out every single week, and 2 times doubled up during AEP. So for Michael's Medicare, of course, I am Michael, hoping that you have a great rest of your day, and goodbye.